Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent whiplash yourself. Sit on the hand of the affected side, then gently pull your head to the side and back with your other hand until you feel a light pulling in the muscles at the front of the neck. Hold for 10 seconds and do this 4 times a day. These are the scalene muscles. If the pain persists, add the following technique. Face the corner of a wall or door frame, place one foot at the corner and the other far back. Hold your hands behind you, bend your front knee and lean forward 45 degrees. Place the front of the neck just above the clavicular bone onto the corner and turn your head slightly outwards. Hold for 10 seconds and do this 4 times a day. If it hurts yet feels good at the same time, you're doing the right thing. It's so easy. The weight of your body does all of the work for you. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If it's easier to turn your head and you have less numbness and tingling in your arm or ringing in your ears, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 2 to 4 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. If your shoulders are bare, cover them with a towel so that you don't scratch your skin. If you'd like to slide easier on the corner, cover it with a plastic corner protector that you can buy in a hardware store. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. In order to accelerate healing, avoid carrying a purse on one shoulder, squeezing a phone with your shoulder, and lying on a sofa with your head on the armrest. Always lower your head when turning to look behind you. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of whiplash, if you heal yourself using my method, it's scientific proof that your whiplash was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, fibromyalgia, calcium deposits, osteoporosis, spinal stenosis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of whiplash is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.